Hi, my name is Sneha, a 10th grade student who has lots of questions about the medical field, as do most people. So I started a podcast, Curing Curiosity, where I get the opportunity to interview both medical professionals and university advisors. Today, I get the opportunity to interview Dr. Madan Roy. Dr. Roy is a pediatrician working for McMaster. Thank you, Dr. Roy, for spending time with us today. Is there anything you would like to say?
Thank you, Sneha, for the invite. It's a pleasure and an honor to be here. It's good to meet you again. And I'm very impressed that a 10th grader is doing this lovely talk. And I love your title of Curing Curiosity. In terms of my background, I did my initial training back in India. I became a pediatrician in the UK, came to Canada about 30 years ago, and have been working in McMaster University as a professor of pediatrics. I specialize in both neonatal care and pediatric care.
So, starting off with my questions, what is neonatal care?
Neonatal care is the treatment of newborns. And newborns are in the range of age 0, which is the day they're born, until age 28 days. So most people think of neonates as up to a month old, and technically it's 28 days, but most people think of neonatal as care in the first month of being born.
So, what's the difference between pediatrics and neonatal care?
Good question, Sneha. Pediatrics involves the entire age range of age 0, meaning the day you're born, up to your 18th birthday. And neonatal care is a part of that, and it's care only in the first month, 28 days to be technically correct, of life.
So, what do you do as a pediatrician?
So as a pediatrician, we do a number of things. We provide both primary care and consulting care. Primary care involves looking after the day-to-day needs and health of children, which usually translates to annual checkups, making sure they remain healthy and are fit for sports for the teenagers, giving them their vaccinations, taking care of minor fevers, coughs, colds, flus. And specialty care, as in consulting pediatrics, is where the family physicians call us for our expert advice, and we help them solve the issue, whether it's a fever that is long-lasting, or an unexplained headache, or abdominal pain, or cough that is prolonged. So we are then the experts providing advice to the family physicians.
So, what made you choose pediatrics?
Pediatrics is just amazing. There's absolutely no way you cannot love pediatrics, Neha. The moment you walk in, the kids are so resilient. It's so good to see these children who, they're flaccid, they're weak, they're febrile when they come in. And next day, they're so much better. They're jumping up and down in their beds. They're giving you a big hug. Children are just such a joy to be with. And it's not just children. You're also dealing with the entire family. So there's a lot of fun in trying to understand what the problem is, because children can't often talk to you. So you become like a detective. The family often doesn't know what's going on because the child is crying, but can't tell you where the pain is coming from. So it's a wonderful combination of seeing the joy of children getting better, of doing some detective work, figuring out what's going on, and of course, making them healthier and bringing them back to their pre-illness condition.
So, if you're, in terms of being a detective, what skills would you require for being a pediatrician and a detective, in your words?
Very good question. I think a few things. Like every detective, your observation skills have to be very good. You have to be able to put 2 and 2 together to make 4, sometimes even 5, okay? Because you have to use those extra kind of observations that you've made.
So how could a student then hone these skills?
At your stage, Sneha, and for kids in high school, a good start would be exactly as you said, curiosity. Find out a bit more about what pediatrics is by reading up on it. Maybe even do some child minding, right? Become a babysitter, get used to handling children of different ages, and then perhaps do some volunteer work in a hospital or in some other medical setting. It could be a clinic, and get to see whether you actually enjoy being with children, because it can be tough. It can be quite tough because children can be crying a lot. And if you're not able to listen to that loud background noise and move on and keep doing your thing, then it's not for you.
Going back to the detective skills you were talking about, are there any tools that help you identify issues?
Tools, like I said, definitely good observation skills. You need to be able to ask the right questions. You need to be absolutely up to date with everything that's going on in terms of the information available. And the clinician skills really comes in putting it together. It's called clinical decision-making skills. So you have a piece of information here, you have a result there, you have a baby in front of you. You now need to be able to match all those. It's like a puzzle. So you have to put the pieces together. And that's where the skill and the expertise comes in. And that comes from years and years of hard work, nights and nights of being awake, lots and lots of patients that you've seen and parents that you've talked to.
So, are there any skills that parents or caretakers could use to look out for any issues?
Parents tend to be amazing. They're very good with their observational skills. They'll often tell you, I've noticed my child hasn't been using his right hand as much. And that immediately gives you a clue of what the next question should be. In general, parents are extremely helpful. Not always, because sometimes they themselves don't know. But definitely, if you give them the right questions and the right things to monitor after you've seen them the first time and they take the kid back home, then they're able to come back to you as a follow-up with the answers that you need.
So, in general, what are things that they should monitor?
So it depends on what they come to you for. But assuming they're coming for primary care, then obviously most parents you'll see will have measurements of the children in their home. They'll have the scale where they're measuring them every 6 months or every year, checking their weight, making sure they're bringing them for their vaccinations, and just observing their development, right? So you want to know, is my child at 1 year doing the things he or she should have been doing at 1 year? How does my child compare to other children at 3 years or 5 years? And if they notice a delay, either in their language skills or in their communication skills, then obviously that's a flag, a red flag for them to bring the child either to a family doctor or a pediatrician.
So, what do you think could be changed about how medicine is taught now? Is there anything you would change?
I think a lot of change has happened. Certainly, we see a lot of use of ChatGPT and all sorts of other apps, which I think is very, very helpful. The algorithms that are now in existence are great because there's just so much to remember that it's impossible for you to remember it all. And having these apps make it a lot more useful. On the other hand, it takes away from actually making the effort to read and remember. So I think modern medicine is going to a place where one has to make sure they have enough clinical experience, enough clinical work and practice, and not just become dependent on the machines.
Okay. So, taking a step back, what is neonatal sepsis?
Well, essentially, an infection of the bloodstream of a neonate. And it can happen either early in the first few days. First 3 days usually is called early neonatal sepsis. It can happen between 3 days and 28 days, which is late neonatal sepsis. Oftentimes, it's infection that the baby acquires as the baby is being born through the canal. And within a day or two, the infection can be bad enough to sometimes kill the patient.
So, what's it caused by? Just birth?
So it's the process of the bacteria that the baby picks up. There's one particular bacteria called GBS, which the baby picks up through the mom's birth canal. And that can go into the bloodstream of the newborn. And then the newborn can get really sick from sepsis. And that's the commonest type of sepsis that we see. And sometimes all you know is that the baby is breathing a little bit faster.
So, how could new parents identify causes and effects?
dads are constantly monitoring the babies, especially the newborns. And they would notice, for example, that the baby feels a bit warm or feels a bit cold. Both are not good. Sometimes they notice a rash. Oftentimes they'll notice that the baby is breathing a bit faster, or sometimes the opposite, pausing between breaths, which is very scary, not feeding as well. So there are lots of little tiny subtle signs, but it can be difficult. So many times these babies do come fairly late and are quite ill by the time they get to us.
So what could you do as a doctor to help them?
So our job is to make the diagnosis, right? So our job is to examine the baby, put the information together, make sure we ask for the right test results, start the treatment even before the results are back if you're worried about infection, because we don't want to take a chance. And then wait for the blood culture, it's called, meaning they try to grow bacteria from the blood. And once that result comes back, you know which bacteria it is, and you have a better idea of which choice of antibiotics to treat the sepsis.
So a cure would just be antibiotics?
Usually that's what it is, yes.
Okay.
The vast majority is usually at least 2 different antibiotics, but yes, antibiotics.
And aside from GPAs and volunteer hours, what else looks good for universities like McMaster?
So for sure, McMaster is looking at the overall package, right? GPA, yes. Volunteer work, yes. And at the level of the interviews, right, they want to know that you are truly dedicated and interested and able to put in the number of hours of dedicated work that will be needed to be successful.
Okay, I think that's it for our time. Thank you so much. It was a pleasure having you.
Lovely, Sneha. I really enjoyed this. I'm glad we could discuss this very, very interesting topic. And hopefully, your friends, your colleagues in school, right? They listen to this. They're encouraged to find out a bit more, maybe even become pediatricians. So at some point, you need to tell me how many of them listened to this and made pediatrics their career. All right?
I do.
Okay.
Thank you.
Thank you so much.